Colleagues, on your desk today is a floor letter from an article, one of two, from the Eugene Register Guard. Health benefits for Oregon employees cost the state more annually than PERS. So we finally eclipsed where our health benefits annually are more than our retirement benefits. Now, most of you were not here when we implemented the Affordable Care Act. I was one of three members that's still on this floor who was on the policy committee for health care that year. And a couple of things that we tried to get accomplished as we did the healthcare transformation. One was we passed the business plan for Cover Oregon, which had an amendment to it that said that in the year 2015, school districts would have been allowed to buy their health insurance through the exchange. But when we lost the tie in the House, we undid that on a party line vote off this floor. So can you imagine what 4 school years, school year 15-16 and this upcoming biennium 17-18 would have looked like if school districts had the ability to buy outside on the open market on the exchange? That decision, I believe, also had a net effect of destabilizing the exchange. We were supposed to get a certain amount of lives into Cover Oregon in order to make it work, and we don't have that now. And so people who are buying their health insurance through the exchange are spending a lot more than we ever intended for them to spend. We also had in the bill that created coordinated care organizations language that said that the Oregon Health Authority would conduct a public process to put PEB and OEB into CCOs. I can tell you from talking to folks in CCOs that conversation never really happened. So there was a bill today that was first read, House Bill 3428, which would trigger that language in the law so that we can have that conversation. The back of the cocktail napkin math, because we've not had it evaluated yet, is that the savings to our public treasury for PEB and OEB alone, if we did that move, would be about $1 billion a biennium. And if you read the article and look at what Washington, California are paying for comparable public health care for their employees, particularly Washington, our neighbor to the north, that pays comparable salaries that we do here in Oregon, Washington State, for their public employees on a per cost average is $1,020 million less than we pay for health care. So while people might want to do things around PERS, and we're going to have some PERS conversations as part of how do we get out of the building, everyone's in a hurry to do that again. The fact is that what we can do is health care. We can go back and get back on track and fix where we derailed our implementation of the ACA. And we can put those savings back in schools, and we can put them back in housing, and we can put them all manner of places. CCOs are ready. I think most of the ones I've talked to so far are ready to have this conversation with us. But when we're talking about cost containment, this is our fix, colleagues. So let's have the conversation before the session ends. Thank you.